Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my non-suctioned, non-lifted, but quite toned and buff co-host, Dr. J. Calvert. How are you?
They're not flapping yet.
They're not. You don't have, I had spoiler alert, we're talking about arms here. I had a patient come in a few weeks ago to tell me that she was there to talk about her highs. And I was like, excuse me? And so she picked up her hand and waved it and showed me all the jiggling skin. And she was like, my highs. You're going to fix them, right?
Yep, you need to fix those. Yeah, I mean, arms are tough.
Arms are tough. And so little background here. We are talking about arms, and we are talking about specifically the upper arms, right? So the part from your shoulder to your elbow. We don't really do a whole lot below the elbow.
No.
But, sometimes extra skin is down there too. But we're talking about people who come in because they do not like how their upper arms look. And it can be for a couple of reasons. It can just be because that's where they carry their weight. There are some people that just carry their weight sort of across their shoulders, their upper back, their arms, and they feel like they look bigger than maybe they are because that's just where their extra weight is. And then there's people who, for reasons such as weight loss, age, gravity, have also developed loose skin of the arms. And these are sort of two different categories of patients, two different surgeries, but both can be true.
Yeah, I mean, people get bothered by their arms for a whole host of reasons. Like being bigger than they think they should be is probably the thing that kind of gets them in. And then, especially when they're younger, you see a lot of women that come in and say, like, my arms just look like linebacker arms. I don't have a lot of muscle. This is all fat. And they'll show you that it's really thick with fat. Yeah. And then the skin hanging is a whole nother ball game that is extremely bothersome. And we do have operations for all of these issues.
All of them.
And again, we're surgeons. So like people say like, oh, isn't there something minimally invasive you can do? And, once again, I will bring home the old adage, if you go to a barber, you're going to get a haircut. You go to a surgeon,
you're going to get
an operation. Yeah. it's happening.
You know what? Yeah, you're right. Why don't I send you down the hall to my, filler person?
They could just, maybe they can just massage the skin off of you.
Go to the massage therapist.
Yeah, see what they can do with some lymphatic. That should take care of it.
No. But if you go to a lymphatic massage person, that's what they will suggest.
They will give you a lymphatic massage.
So
100%.
Yes. So know who you're going to. But let's start with the most non-invasive lymphatic massage, all the way up to like my level of invasive.
Yes. Maximally
invasive. Cut that shit off.
Yes.
Surgery.
Cut it from elbow to armpit, sometimes down the side of the thorax, connected to the breast, whatever you got to do. Like that's upper body lift
there
inclusive.
Are ranges. So at its most minimal, okay, let's go super minimal. Say you don't have a lot of fat. Barely any fat, and maybe you just have a little bit of loose skin. You're like getting into like your 40s maybe, and you're seeing some loose skin. You don't have a lot of fat. There are some non-invasive options. Is that you, doctor?
I have an answer.
No. Oh.
Are you asking?
Sure, yes. What would you do for that patient?
I think that the Morpheus is good for that.
The Morpheus,
I think that's good for
gold
that.
Star.
Thank you.
Yes. So I would suggest Morpheus.
Yeah.
Morpheus is a radiofrequency technology combined with microneedling. It's designed for the body and for the face, and it works great for these patients that don't really need a surgical tightening. They just need a little bit of something. So yes, hit them with the Morpheus, 3 treatments every 4 to 6 weeks, and that may be enough.
And you said you've seen good results with your patients that you've recommended that.
I think for the arms, it does work pretty well.
Good. I think it's a good way to go because you don't lose anything, and if it doesn't work, then you can go to our next level.
You can go up to the next level. Say you're a patient that has some fat on their arms, but relatively good skin. So you're maybe a younger patient, or you just have good skin, good genetics, and you don't really need a whole lot of skin tightening. You just have some extra fat. These are great patients for liposuction. Fantastic. You can really skinny down the arm and remove the extra fat. And if you have good skin quality at baseline, frequently the skin will snap back and accommodate the new size. If you have availability to do any kind of skin tightening at the time of liposuction, a Renuvion, a Body Tight, something like that, that works really well too. That's an energy device that's applied under the skin at the time of liposuction, and it also works really well to tighten up the skin.
And we have those at the Roxbury Clinic and Surgery Center.
We have all of those devices you can add to the liposuction. Although sometimes you can get, if you have good skin, you don't always need them, but it is helpful. I feel like if you have the option and it's given to you, you might as well take it because it can only help tighten things.
Yeah, I've seen good results with Renuvion and the Alma lasers. Just for full disclosure, I am a luminary for Alma lasers, and I've used that system quite some time, which it's a diode laser. And then the Renuvion is a J plasma laser. It's basically using
Radio frequency and helium.
Well, it's helium and cautery, basically.
Yeah.
You're sending cauterization charge down the helium to the underside of the space that's been liposuctioned. And I think both of those work for arms. If you have good skin, it's going to work anyway. Liposuction works.
It works well. Liposuction on its own can help tighten the skin. And I always think these patients, they're so funny because they come in and I universally hear the same thing. I just want skinny arms. Like they look at their mom and look at someone else and they look at a celebrity like, how does Kim Kardashian get her arms so skinny? Like, I just want those skinny, twiggy arms. And I kind of have to be like, you're probably not the person that's ever going to have skinny, twiggy arms. And if you look at the rest of your upper body, that's just where you accumulate your weight. And so sometimes it's a good idea to combine liposuction of the upper back and kind of the back shoulder area for these patients. If what they come in for is that concern, like you mentioned, I feel like I'm a linebacker. Sometimes if you combine a little bit of liposuction of the sides of the chest, of the upper back, you can actually really change their overall size. You can take them down a shirt size if that's their overall concern. Combining the arms with the upper back is a really helpful maneuver.
Yeah, and it's the aesthetic. I mean, that's the whole point is that you want to do the arms, but if you need to do the armpits, the axilla, the thorax, along the chest wall, the back. I just did bra fat on somebody. It looks so much better. I mean, she still has the skin. I'm going to say that because I was like, we're probably going to need to cut skin off. She goes, I don't want those scars.
Yeah.
The scars are tough. Those upper back lifts.
Yeah, that's the next issue, right? It's patients that have extra skin.
Yeah.
And now we're getting into that arm lift territory, the high highs that people come in with. Because sometimes there is an abundance of skin in the presence of extra fat or just on its own. You might just have the extra skin. And if you have extra fat and extra skin, then you need liposuction combined with a skin excision. Sometimes you can get away with just a kind of a skin excision, and that's called a brachioplasty. There are various degrees of brachioplasties. At its smallest, a limited incision brachioplasty, you put an incision in the armpit, like right, where you put your deodorant, and you just take out a little crescent of skin and you kind of pull it up towards you and you suture it down and you're like, oh, you're fixed.
That doesn't work.
But it doesn't really work.
No.
I mean, maybe if you have like 2 or 3 centimeters of extra skin right next to your armpit, that might work. But if you're trying to hide the incision while still taking out, a moderate amount of skin, it's pretty hard to do while still keeping that scar fully hidden. So the limited excision surgery, I would probably refer that patient for one of the energy devices, liposuction plus the Renuvion plus a Morpheus. I think would get you the same benefits as a limited excision for the brachioplasty. A traditional brachioplasty incision, they suck. Those incisions start in the armpit and they usually have to go all the way down to the elbow. The times when I've tried to not go all the way down to the elbow, the skin doesn't drape right. It's not in continuity. You still look like you have extra skin around the elbow when maybe you didn't look like you had it there before. Like you have to treat the whole upper arm as a unit. It's kind of hard to just break it in half and say, I'm only going to put an incision here because it doesn't always flow very well. So that incision sits on the inside of the arm, so right under your biceps. So if your arms are by your side, you're not going to see it. You won't see it from behind. But yeah, if you wave your arm and you say hi to somebody, you will see that incision front and center. So patients that come to me and say, well, I'm doing this because I feel so self-conscious in tank tops and short sleeve shirts because of my arms. Well, now I'm putting an incision on your arm. So it's a hard thing to have to wrap your mind around.
Yeah, I've found that the bicipital groove, this incision that goes, from the armpit down, as opposed to on the back of the arm.
Oh gosh, I don't know why did people ever do that? They're like, well, because then you can't see the scars. I'm like, yeah, you can, but what
But
about
everybody else
everyone
does
who's
behind you.
behind you?
Yeah.
Yeah, that's one technique, is to put it down the back of the arm, and it's got to be the ugliest thing. Sorry if anyone out there does that, but you
A lot of
shouldn't.
people do that. A lot of people do. I mean,
It's ugly.
That was the first brachioplasty. Like, I went to a body contouring course with, and I won't say who, but because he's a really great guy. But he showed that incision on the back of the arms, and I was just like,
Ugh.
I have a question. What? Whereas if you do it in here, it does. So I will tell you though, if you really get after those scars, you microneedle them, you inject them, you do everything that you can, they can be okay. I have
Over
some that are
time.
really okay.
Yeah, this is like a year or two long process. I saw a
Yes.
lady back who is 2 or 3 years out from her brachioplasty, and I thought her scars looked awful that whole first year. And then when I saw her a few years later, I was like, oh, those actually aren't so bad. Can you see them? Yes, but they were way better than they were at even a year.
I mean, you can work at them. It's
Yeah.
like, you just have to. You got to make it part of the plan.
Part of the deal. And even people, and I hear this all the time, oh yeah, but I scar really well. Or, if I've done 3 surgeries on them already. We've done their tummies, we've done their breasts. And yes, those scars are beautiful. They're like, yeah, but look how good these look. I'm like, I don't care how good those look.
Yeah.
The ones on your arm are not going to look great. And it's for a couple reasons. This area is particularly prone to wound breakdown. I think it's a combination of just poor blood supply to that area. And even if you don't pull it super tight, there's a tension on there, and their incisions are prone to opening up. And then even if they don't open up, they tend to thicken, they get red, they widen. It's not a place that's optimal for wound healing, no matter how well you scar. So that is my concern about putting scars on the arm, is that those scars are going to be very visible.
Do you tend to bring the brachioplasty scar down onto the armpit on the chest wall? Is that sort of your norm?
An L brachioplasty all the time.
Yeah.
Yes. But that just speaks to a lot of the patients that I have, which are usually weight loss patients. So their extra skin doesn't stop in the armpit. It involves the upper body and the sides of the chest. So I very routinely take that incision up into the armpit and then down the side of the chest and bring in some extra skin from the lateral chest wall. So it's like an L shape or a hockey shaped. And those are big incisions, but you kind of have to. It's part of the deal. You're already there. And then in a really extreme situation, you can incorporate it with an upper body lift or a breast lift, but then it just gets really fancy. So I usually, if I can, just stop with the brachioplasty. That's enough incisions to heal at any given time. We can come back and do more later.
Yeah, I mean, it's there's, with body lifts, you really can be very creative. You have to kind of address the problems. I always just tell patients to give me like, what are your highlights? Like, what's bugging you here? Because that's what we should do first. And if it's the arms and the breasts and the back, well, then that's what you go after. If it's their tummy, you do that. But I mean, I am so out of that business now. I'm really happy that you're doing it. And
I usually start with the tummy or the breasts because I worry that if I start with the arms, I'll never get them back.
You should do that last. That's a good idea.
Because they're going to love their tummy. They're going to be thrilled with their breasts. And then we can talk about whether or not it's a good idea to do their arms. But if they start with their arms, they might just quit right then and there, based on how the scars look. And the other thing that we didn't mention is the healing of these brachioplasty scars. So for the first couple of days, it's like post-surgery, there's some drainage or some pain. But it's okay. You get through it. There's some positioning issues you have. You can't raise your arms higher than shoulder height for a couple weeks just to keep the incisions from breaking open. The problem is a lot of them just will break open regardless. And that means that the incisions that look beautiful on day 7 beautiful on day 8. By the time you get to day 10, you're seeing little areas start to open and separate. And then you're doing prolonged wound care, and it's a pain in the butt, and they're doing all these dressing changes. So the recovery process from a brachioplasty is just obnoxious in a lot of ways. And they're uncomfortable, and it's like sweaty under their arms, and like it's not a fun recovery. I'm really selling this surgery, aren't I?
I want to have one. I'm ready.
Yeah, sign me up for what she's talking about.
No, but
if you need
very
it,
happy. They're very happy when it's over. I can tell you that I have a lot of happy brachioplasty
they
patients.
are. I know, and I'm like bashing this surgery, but you are so right, because they are so tired of dealing with that extra skin and having to buy shirts 2 sizes too big for them, that when you do remove the skin, they're like, yeah, whatever, it's a scar. Who cares?
Just look at the before and afters. They are dramatic. I mean, I've got ones with like skin hanging down, and then it's gone.
Yeah.
And that is very satisfying. And so from that standpoint, it's a winner. But from a plastic surgical going through it standpoint, it's a process, and you have to be up for it.
Right. So that's where it just comes to really choosing the right patient. I mean, I am not shy to jump on saying, you need a tummy tuck. Let's cut that skin off. Like, don't futz around. Like, let's do this. Same thing with a breast lift. When it comes to the arms, I'm like, ooh, can we get away with anything else?
Yeah.
And if the answer is yes, then I will try to do everything else first. Some cases are a slam dunk. No, you got to take some skin. But if you're at all borderline, I may try and push you towards doing something a little bit less, with the knowledge we may need to come back and take some skin.
I think that's the way to do it. I definitely read the riot act on all liposuction of the arms cases, saying like, look, you may still need the skin off.
You may still need the skin off. And then the only other patient population I want to touch on that I see frequently coming in requesting an arm lift, and they probably need it because they have extra skin. The problem that they also have is that their arms are just really large, like really large. And here's the thing with a brachioplasty. We already talked about why it heals so poorly in just about anybody. But then if you put on top of that a lot of fat in the arms, it's really never going to heal. And so if you're coming in asking for an arm lift, but your arms still have a lot of fat on them, you're going to need an aggressive amount of liposuction. Like, that's 2 surgeries in one. You need full 360 liposuction of your arm. You have to skinny it down as much as possible and then do the skin excision. So that's like 2 surgeries in one, and the price is going to reflect that. Because if all you're trying to do is remove the hangy-downy part and you're leaving behind these big, thick, the high-highs, but you're still leaving behind a big, thick arm, it's never going to heal well. And the wound healing issues on that will be abominable.
I do most of them that way when I do them, where I suction them like aggressively. I have to say, though, it does work out. I only mention that because I have patients that come in and have somehow eked out an insurance authorization for the brachioplasty. And I refuse to do it unless I can do the liposuction. Insurance does not pay for liposuction. And so they get very upset that they now have to pay for a liposuction procedure. I'm like, well, you're welcome to go somewhere else. Maybe someone else won't do that. Right.
But for my purposes, to get you the best result and to minimize complications, you're going to have to pay extra for the extra liposuction.
Yep. It's always the insurance company has a way of saying, like, we'll do some of it.
Not all of it. It's not just liposuction of the skin you're taking. Like a lot of times I can just do that. Like just that extra part under the arm that hangs down. You liposuction that part routinely as part of the surgery. I'm talking about all the extra 360 liposuction of the entire arm.
Oh, yeah.
That's not included in a standard brachioplasty. No. That's going to be extra.
And this stuff ain't cheap. We always talk about it. Listen to the Cost of Plastic Surgery podcast, which everybody has said, like, yeah, I listened to that and I get it. I get it.
I get it. It's expensive.
Whatever. Yeah. But it is. Plastic surgery costs money. I'm sorry. It does. It is. It costs us a lot of money to do it.
The average price of a car in the country right now is $55,000. If you're going to spend, I know, right? If you're going to spend that much on a car, don't you think you should put just as much an investment in someone that's, cutting up your body?
Yeah, so when I was growing up in New Jersey, I remember that plastic surgery was the cost of a car. So if when I was a kid, a new automobile was probably like 10 grand.
Yeah.
But if you wanted to get a rhinoplasty or a facelift, I mean, there are people charging 10 grand.
10 grand.
And there are people right now, right here in Beverly Hills, charging a little more than 10 grand for a rhinoplasty.
Yeah.
That's 30 years later, 35 years later, the price hasn't really changed of plastic surgery that dramatically.
Right.
The price of automobiles has.
Everything else
The
in this world.
$10,000 car that we were buying then is now a $50,000 car.
Yeah.
Probably more. It's probably more a $60,000, $70,000 car. So plastic surgery has gotten less expensive as there are more people doing it. It's less expensive to deliver. The risks have come down. Because by the way, back in that time, plastic surgery was a bit dangerous because of the anesthesia and all that sort of thing.
It was a commitment. Yeah.
It was a whole different ball game. So I think it was a bit more of a stretch for people to have plastic surgery. Today, safe. The techniques are effective. The results are really, really different, and it's very reliable when you go to a board certified plastic surgeon. So I think today, things have changed, but still, it ain't cheap to get a brachioplasty.
With your 360 liposuction. But, come and get checked out. See what works for you, where you fall on that spectrum.
Look at the before and afters.
Interventions.
We always say it.
Look at them. Check out the scars. Be very realistic about that. Maybe you need them. Maybe you don't. But like you said, as much as I've been whining about the surgeries, very happy patients.
Patients are happy.
Patients are really happy. They have the worst wound healing issues, and they're like, Doc, I love them.
I don't even want to mention thigh lifts, so we won't.
No, we're not even going to do a podcast about it.
Good. Well, I think then we've hit it all.
That's it. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.